I initially planned to save the knee for the last joint in this series since I feel it's probably the most controversial joint we're going to discuss. The more I thought about it though, it made sense to round out the rear end of the dog at this point in the series. The knee is a complex condylar synovial joint, sometimes called a hinge joint. The general structure of the joint is very similar to our own knee. The main components of the joint are formed by the condyles of the end of the femur or thigh bone, articulating with the flat top of the tibia or shin bone. This is where the shin would be. There are a number of ligaments that make up the joint, including the cruciate ligaments, which are the two ligaments that cross, hence cruciate. In you and I, they are referred to as the anterior and posterior cruciates, and in dogs, the cranial and caudal. But in both cases, it's the front ligament of the two that is the one we associate with cruciate rupture or disease. Essentially the same function and location, just with different names in the two species. Most people refer to the cranial cruciate as the ACL in a dog too, which is fine. There are also the medial and the collateral ligaments. The main tendinous feature of the joint is the patellar tendon, which is actually the tendon of the quadriceps, which contains the ossification of the patella or the kneecap. And there's also a joint capsule associated with this joint. Within the joint, there are two fibrocartilaginous structures that help even out the articulation and act as a shock absorber for the joint, and they're called the meniscus, which you're probably familiar with. There is a medial and a lateral one, and they both sit on top of the tibia or that shin bone. The joint space, so inside the joint, is filled with synovial fluid, which is a thick, sticky fluid that we'd like to say lubricates the joint. All of these structures come together to allow the knee to function normally. And while we like to think of the knee as hinging with flexion and extension, these structures also allow some degree of lateral and medial movement as well as torsion. There are two major issues that we see with the knee. There are other conditions that can occur, but for the time's sake, we will just be discussing the two most common. The first is a luxating patella. This is basically when the kneecap pops out of place. I'm sure all of you have relaxed your muscles in your leg and moved your kneecap around, which is normal. Even with this movement though, it is staying within the confines of the groove of the femur. With a luxating patella, the kneecap pops outside of the groove, typically medially or towards the other knee. What you will see in most dogs is a sudden acute lameness, and they'll often hike that leg up high. This can be followed by just as sudden resolution in some cases. Basically, when it pops out, these dogs will go lame, but if it manages to pop itself back in place, they'll appear completely fine and normal. The condition can happen in two ways. One is developmental, meaning that the structures are just formed incorrectly. This can be a groove that is too shallow, attachments of the tendons and ligaments that don't hold things in place like they are supposed to, and in the vast majority of these congenital cases will result in the patella sliding medially. The other way it can happen is a traumatic injury, which can cause that patella to luxate out. Luxating patella is much more common in small breed dogs, so think things like Yorkies, Poodles, Shih Tzus, and it does happen with semi-regularity in our Spaniel breeds on the sporting dog front. I'll also see this in larger sporting breeds, but definitely not as common, but maybe one or two a year with dogs like Labs and Goldens. If a dog is clinical, meaning it is showing signs of lameness, then this is almost always a surgical fix. This is particularly true if it's a congenital issue, meaning it's been there the entire time. On rare occasions, mainly with the traumatic luxations, I've had some success with a dog avoiding surgery with a rehabilitation program. I always think it's worth a try, but I set expectations for the owner very low. This is one condition that sometimes will actually worsen with rehabilitation too, as we are specifically targeting the affected limb, which sometimes means we can exacerbate the issues. In those cases, surgery is the solution. Surgical correction usually involves some combination of deepening that groove, placing sutures to keep the patella from tracking medially, and in some cases, a tibial transposition, where we basically change the place that patella tendon attaches. The vast majority of dogs do very well post-surgery. One word of caution. I will say that the bigger a dog is, the more chances they are to break down the surgery correction if the post-op instructions are not adhered to. I had initially planned to also discuss cruciate ligament disease in this video, but the more I wrote, the more I realized that subject will need at least 2 videos and maybe 3 of its own. In the next video, we will start with an introduction to cruciate ligament disease.